In the last video, we saw the shortcut method to find the percentage of unionized drug and the percentage of ionized drug by simply calculating the difference between the pKa of the drug and the pH of the medium at where the drug is present. So, if the difference between pKa and pH is 2 units, we know that 99% of the drug exists in the unionized form and 1% of the drug exists in the ionized form. So, by this we can tell at the acidic pH the drug is better absorbed. Weakly acidic drugs are better absorbed. Similarly, consider any basic drug, weakly basic drug with a pKa similar to 5. The majority of the drug is in the unionized form occurs in the basic pH. So based on this, we can draw some conclusions. Weakly acidic drugs are better absorbed in the acidic pH, whereas weakly basic drugs are better absorbed in the alkaline pH. We can see this by an example. Consider weakly acidic drug, aspirin. It exists in equilibrium between the ionic form and the non-ionic form. So when the aspirin enters into the acidic pH, so in the stomach it is saturated with more number of protons since it's an acidic medium. So it picks up the proton and converts into the unionized form. So the equation is more towards the left side. So more amount of drug will be in the unionized form. So unionized form of the drug is better absorbed in the acidic medium. Similarly, what happens to this acidic drug in the basic medium? So when the aspirin enters the basic medium, the ionized form of the drug exists in the ionized form itself. There is no reaction in the basic medium. So weakly acidic drugs remain ionized in the basic medium. It's vice versa in the case of weakly basic drugs. Consider weakly basic drug when it enters into the acidic medium. It ionizes. So weakly basic drugs, it picks up the proton which is present in the acidic medium and it further ionizes. When this enters into the basic medium, it unionizes or it is unionized. So weakly basic drugs are unionized in the basic medium, whereas weakly acidic drugs are unionized in the acidic medium. So weakly acidic drugs are better absorbed in the acidic pH, whereas weakly basic drugs are better absorbed in the basic pH. In case of weakly acidic drugs, if pH is less than pKa by 2 units, 99% of the drug exists in the unionized form. When you consider the same for weakly basic drugs, here the pH should be greater than pKa by 2 units. 99% of the drug exists in the unionized form and are better absorbed. So you can consider any drug a weakly acidic if its pKa is greater than 8. Example is paracetamol, which is having a pKa of 10. Moderately weak acidic drugs are the one which is having a pKa in between 2.5 to 7.5. We already saw an example of aspirin which is having a pKa value of 3. And strong acidic drugs are the one which is having a pKa less than 2. And coming to the weakly basic drugs, they are the one which is having a pKa of less than 5. For moderately weak basic drugs, pKa is in between 5 to 11. For strong basic drugs, pKa is greater than 11. So, theoretically we saw acidic drugs are better absorbed in the stomach. Basic drugs are better absorbed in the intestine. However, practically speaking, acidic drugs are not absorbed in the stomach because stomach is more of a storage organ than a absorptive organ, and the thickness of the mucosa, thickness of the membrane is very large. The presence of food and other factors inhibit the absorption of the drug from the stomach. And maybe some drugs are inactivated by the presence of enzymes or acidity or bacteria present in the stomach. So, practically, acidic drugs are better absorbed from the proximal part of the duodenum. Basic drugs are absorbed from the distal part of the ileum.